Hello, my name is Dr. Thomas Wang, and I am joined by my colleague and mentor, Dr. Marvin Yu. We are proud to present our work that was performed when I was a fellow working with Dr. Yu at the Brigham Women's Hospital. So thank you, GIE, for the opportunity to present our study here, which is titled EUS-guided shear wave elastography for fibrosis screening in patients with obesity and metabolic dysfunction associated steatotic liver disease, a pilot study with video. Marvin, if you don't mind, just introducing a study on kind of why we were interested in this topic initially.
Sure. Yes. So, Thomas, first of all, really fun experience doing the study with you. Why don't we start with talking about shear wave elastography? So, shear wave elastography is a different type of elastography. It's now available on the newer endoscopic ultrasound units. It's potentially more accurate than other elastography modalities that we've certainly had in the past with our older EUS systems, and it may be more accurate than our FibroScan transabdominal platforms. EUS shear wave elastography is a two-dimensional form of elastography that assesses underlying tissue stiffness. And it's able to measure a two-dimensional swath of tissue or region of interest that the operator defines in the liver parenchyma. And it's a very user-friendly software program. The measurements are relatively quick and straightforward, and it produces the measurements with kilopascals as a unit of measurement, which just happens to be the same unit of measurement the FibroScan uses, also MR elastography. So now we can start comparing these measurements. They're actually quantified. So our hypothesis was that the EUS-guided EU shear wave elastography is more accurate compared to transabdominal modalities, precisely because the distance between the transducer of the EUS scope and the liver surface is reproducibly a short distance, regardless of body habitus. But in obese patients with MASLD, that distance is much greater when you're using a transabdominal probe. And so you and I, Thomas, we've been interested in this concept for a while. We've done preclinical work defining the optimal technique for EUS shear wave elastography. And here in this study, we were trying to apply what we had learned in the preclinical study to a pilot human study. So again, our hypothesis here was that shear wave elastography is more accurate for fibrosis staging in patients with MASLD and obesity.
Yeah, that's great. So effectively, what we did then is that we took consecutive patients at our hospital who underwent EUS-guided evaluation for suspected MASH with liver biopsy. And during those procedures, we then look at the shear wave elastography of each of these individual patients. So effectively, it was a prospective collected cross-sectional study, which we then uh, took these US shear wave measurements before knowledge of the liver biopsies. So what we did was that we went in, looked at the liver under US, drew a region of interest at the area confined within the liver parenchyma, and was able to then take 10 measurements and took the median of that measurement as our recording in kilopascals. We then compared this measurement to the gold standard of the liver biopsy to generate an area under the curve analysis to see if it was a predictive model for both advanced fibrosis and cirrhosis. We then compared the US shear wave to both FibroScan and FIB4 and see how it compared to it. What we found was that it was statistically significant in achieving superiority in predicting both advanced fibrosis and cirrhosis compared to both FIB4 and FibroScan. And we found was also the results overall were very encouraging. We were getting the Z statistic, which is basically a number from 0 to 1 that effectively measures how accurate something is under the area under the curve analysis. Um, and we found was about like 0.87 to 0.94 in predicting from like significant fibrosis all the way up to cirrhosis. And this is much better compared to what we normally see in the literature. For example, for FibroScan in a very similar muscle matched population where they normally get 0.7 to 0.8. So these are very encouraging early pilot study results. And Marvin, if you don't mind, just kind of telling us what you think are the implications and like the future directions of this particular technique and technology.
Yeah, thank you, Thomas. So
Yeah.
again, a pilot study, but very encouraging results showing that EUS shear-wave elastography is superior to both FIB4 and FibroScan for assessment of liver fibrosis in patients with MASLD and obesity. And I think looking forward, we're looking at performing additional studies with additional patients to confirm these findings, as well as to delineate thresholds for the different fibrosis levels. We thank GIE again for the opportunity to talk about our accepted manuscript, and please see our study for additional details.
Thank you.